No medicine can remove the cause of a lifestyle disease, but you can. Welcome to Lifestyle Disease Doctor. Today we begin a journey on heart health. For those who are interested to know more about heart and the various factors that affect it, and also for those who may be planning or thinking about the need for any procedure or treatment for the heart, and also for those who are recovering after any treatment protocol for the heart. Today we have Dr. Jolly Thomson with us. She focuses on clinically supported lifestyle correction for lifestyle diseases, and heart is very much a subject. The first question to Dr. Jolly is, what is heart disease?
Heart disease means any disease affecting the heart. In medical terms or in the medical systems, it is not heart alone is considered as a single unit. Cardiovascular system, the blood vessels, which is the arteries and the veins also is affected actually. When the heart is affected, this arteries and veins also is affected. So whenever we mention this a cardiovascular disease or cardiovascular system. So now the most common, the second question is why it is so common. The most common heart disease is actually coronary artery disease. The arteries which is giving blood to the heart itself is getting affected. That is the most common thing, and that is actually leading to this angina and the heart attack. And it is in the severe cases, the cardiac arrest also happens.
Generally, it is said that the lifestyle changes are contributing to making it so common. So, what are the lifestyle changes that really affect heart disease or the heart? And generally, it is also said that earlier genetics and age was the primary factor, but now that alone does not get that much importance because of lifestyle overcoming those factors.
Actually, now we are getting more and more insight into each disease. Previously, we were not knowing about why this heart disease is coming. Now it is very clear that it's a lifestyle disease. Definitely, if a family member, father is having the disease, the children also have the chances high. But the genetics is only one aspect. Actually, the lifestyle is the major factor. That lifestyle means one is the food we eat, second is the activity we are doing, and third is the toxins we are coming into. All these factors have changed in the recent years. Our lifestyle is so sedentary because of this mechanization. We are using always for the transportation vehicle is there, and almost all the activities, the mechanical assistance we are getting. So human input on the physical activity is reducing. But another aspect is food. Actually, the calorie. Actually, when you are not doing much of the physical activity, your calorie need is reduced. But we are not reduced the calorie need. Food actually is, supply is increased, so we are eating more and more food, and also the quality of food is reducing because of the processing, and the toxin inside is also increasing because of the newer mass farming, this pesticides, and also mass processing, adding preservatives, colors, and tastemakers. So many changes are coming into that. So this is all actually when you eat the food, it is not going into the stomach and it is entering into the blood vessels actually. So all the impact of this toxin or the excess food and everything is giving an impact on the blood vessels, and if the and also the heart also. It's a part of heart is also part of. So it is affected, and that is the reason now the heart disease is more and more. Even with very young age, the children also gets heart attack. We are hearing that 18-year-old is suddenly got a heart attack and dying, and things are there.
Actually, we hear more like hypertension, blood sugar, high glucose levels, cholesterol, triglyceride, and stress and all that create opportunity or chances for increase of heart disease. But what is now heard is beyond all that, it is inflammation that is the factor that is affecting. So what is it that patients should understand about inflammation? Because none of us normally come across, measuring inflammation very commonly in labs and all that.
Actually, there is measures, very good measures, tests are there to assess the inflammation actually. Basically, what we should understand that almost all the disease has an inflammatory factor. So only the symptoms come If you have a pain, that means there is an inflammation. So it is a symptom, the pain or the fever or the redness, even the swelling. It's a sign. It's a symptom actually. This symptom is coming because of the inflammation. And for the heart disease, why inflammation? So actually, the inflammation comes only when a toxin is coming into. For an infection, if you are corona, we are in inflammatory markers also. We are assessing actually CRP, HSCRP, and all these inflammatory markers. This HSCRP is very specific for the heart and the blood vessels, more of the very specific. CRP is a general indicator of inflammation. Usually for the infections like a corona and all, we are looking into the CRP. And also there are other inflammatory markers for the heart. Then why this inflammation is coming? This, if your diabetes is an inflammatory disease, the sugar itself is making the blood vessels and the heart inflamed, because the excess sugar is running through this heart and this blood vessels, so they will get damaged. That is actually the reason for this. It is called inflammatory disease, and because of this thing and this cholesterol or the fat inside the body is this inside the blood vessels is increasing, then we usually call it as cholesterol only. Actually, it is lipids. Actually, it is not cholesterol alone. It's the triglyceride that is actually making them more troublesome. And it is also just like the glucose is excess, triglyceride is excess in the blood, and this is also making the blood vessels inflamed. And there is this triglyceride means it's just fat. There's no space for the fat to be deposited, so it will be deposited inside the blood vessels. And when it is deposited inside the coronary arteries, which is supplying blood to the heart muscles, that is getting blocked. That is called this. We are doing angiogram or the CT angiogram, or looking for the how much is a block is there because of the fat accumulation. Actually, because of the whole these problems is because of mainly major part is this excess glucose and excess triglycerides, the fat or the lipids, is damaging your blood vessels. So that is ending up with the block and the heart attack and even the stroke. That is blood vessels. If the heart blood vessel is affected and blocked, it is called a heart attack. And if the brain blood vessels is affected, we call it stroke.
Actually, what is the connection between hypertension, high BP, and heart health? Because that is something which everyone is really concerned about.
Why hypertension? It is linked with the heart. Actually, what is hypertension? We should understand that first. It is the tension. It is the blood is applying on the blood vessels, the arteries. That is called hypertension. That means if the more tension is there, the pumping heart is the flowing blood is exerting on the blood vessels. That is called the hypertension. That is not all. That is usually the venous arterial pressure. If increasing, it is called the hypertension. Why it is happening? You should understand. When there is narrowing of the blood vessels, because of it, this atherosclerosis or fat accumulation inside the blood vessels. Many people must have seen that lipoma, that is fat deposit on the skin, it is making under the skin and making bulges on the skin. There are people who's getting multiple bulges. Just like that, the atheromatous plaque means small bulges is happening inside the blood vessels, and this is creating block to the free flow of the blood vessel is blocked. So the heart has to pump with more power to give supply to make the blood reach the cells. So the heart has to pump higher and higher force, and what happens? The heart muscles will become hypertrophic. We know that when we wait, all this weightlifting exercise and all is to increase our biceps and all the muscles in the gym. So just like that, when the heart is doing more work, the heart muscles will get bulky. So that means more, and also the more blood is needed for the heart. But the poor coronary arteries, that is too small arteries, and they are also blocked with this fat, and it is not giving enough blood to the heart muscles. And if a coronary artery is blocked, then you get a heart attack. But generally, the whole system is almost 60,000 miles blood vessels are there. And when there is blocks or atherosclerosis, it will increase the blood circulation, blood pressure. And also most important is this kidney has a very important role in controlling the blood pressure. When the kidney blood vessels is affected with the atherosclerotic plaques, the flow into the kidney will be reduced, and kidney will produce a renin, particular hormone is there. So renin angiotensin, which is produced by the liver, and aldosterone, which is produced by the adrenal gland, which is sitting above the kidney. And these three are interacting and making the blood pressure go high. And also there is inflammation, there are so many inflammatory markers are coming out. They are also actually influencing the blood pressure to get high. Actually, for the hypertension also, actually we are actually in this renin angiotensin mechanism we are blocking. That is why we are getting a relief with the or reducing the BP with the medication, with the different sort of medications we are using for this. And all this is actually reducing the this one of this hormone. There are many hormones involved in the blood pressure control, and we are blocking or some way or other we are trying to manipulate that.
Actually, the most common procedures like angioplasty and bypass, what happens is after that, the patient usually thinks everything is fixed. And not only the patient, the caregivers also think like that. So, what is it that you think patients should know in brief after a angioplasty or a bypass about their condition?
First, we should understand that the problem is excess fat deposits, the coronary artery disease or this hypertension. The problem is actually fat deposits inside the blood vessels. If you have a problem and you're doing a angiogram, and if there is 45%, 50% block, no doctor will say for you for a stent application or bypass. But if it is 80%, 70%, 90%, depends on the patient's complaints, we will go for it. The cardiologist, intervention cardiologist is the one who's doing this stent. So they'll be putting a stent inside. What is a stent? Everyone should know. You should be knowing, the patients also should be knowing that what benefit and what it is. If the stent means steel, the steel rod, not rod, some spring sort of thing, and it will be introduced either through your uh, hand or through the femoral, that is from the groin. We are entering the blood artery and going into the aorta and reaching the uh, aorta base. There, actually, the base of the aorta, the two coronary arteries are giving blood to the heart. So they are going and injecting a dye into the coronary arteries and taking the picture, and we are saying this is an angiogram. So even when you are applying this dye, because it is toxic nature, the blood vessel makes contract. That is a natural thing to contract also. So this can be because of a spasm, because of this extra element coming into the blood, or it can be an atherosclerotic plaque can be there. So it is if there is a block also, we cannot take it as 100% it is because of the block. It can be just a spasm because of this medication, injection of this medication itself. So if the blood vessel is sensitive. So it is not curing you. You are introducing an external material into the coronary artery. Actually, everyone should see the pictures of the coronary arteries also. Actually, it is traveling on the surface of the heart. It is not as from the surface. It is going penetrating arteries into the heart muscles. So if it is going into the surface of all these things actually in the angioplasty also, yeah, through the catheter, this catheterization, this stent is introduced, that if there is a block is there, it with a balloon it will be dilated and the stent will be put. But this stent, what it is doing, it is just separating, and this is just pressing the fat to the sides. That's all it is doing. It is not doing any removal of the fat or anything. So, but the problem is still there. And what is the additional problem we are actually accepting when you are putting a stent on even nowadays there are 3-4 stents are put in the same sitting. I've seen patients with the 5 stent put in the single sitting. So 5 metal pieces in the different part of the coronary artery, that is this very small arteries which is traveling on the surface of your heart. So what is the problem with all this? That also we should all understand. It is a foreign body, and the blood clot can occur in that, because any foreign thing, it has to be removed or secluded. That is the body's nature. It is the immune system will try for that. So what is actually happening? Then when you put after the stent, the clot formation and making a block because of the clot is very high. That is why there are 2 or 3 tablets for this blood thinners will be given. Actually, this coated, nowadays we are using only the coated, medicated stent actually. That is also is anti-inflammatory. It is one of the medicine which is used for the cancer treatment and all. It is coated on that metal piece. But that is not giving 100% guarantee because the blood is so flowing very fast. So this coated can be gone within no time actually. That is why this anti-platelet or this blood thinners are given not to make the clot. So your problem is with the stent, your problem is not going actually in other way. It is increasing also. So if you want to get a real benefit, you have to know it's not the disease is not because of the lack of a stent or a bypass surgery or anything. The problem is because your lifestyle. You have to do the lifestyle correction. Whatever, if you're putting the stent or if you're without putting the stent, if you can get your lifestyle corrected, this excess fat inside the blood vessels can be removed, and you can. The problem will be over only if you do the lifestyle correction because the root cause is the lifestyle.
Actually, you often say that, with respect to stent, that people, generally patients, have to do repeat stents because they don't understand why the stent was done in the first place. Regarding this bypass, what is your opinion?
See, because latest studies, there are many studies which comes long-term studies are there. So generally, the study shows that whether you are taking, there are 3 in the modern medicinal aspect. Actually, for the 4 types of treatment are there for this coronary artery disease or the cardiovascular diseases. One is the lifestyle correction. That is the primary for everything. All the aspect lifestyle correction is a must. Or lifestyle alone can be applied. And if it is when you are failing, you add medication. Then is the medication. Third is the interventions, PCA, percutaneous coronary intervention, that is applying the stent. Fourth is the bypass surgery. See, with all the long-term studies, it is showing that whether there's no study about the lifestyle correction alone or clinically. I'm actually giving a clinically supported lifestyle correction, and I think that is one. I don't know how much in the other part of the world it is used. With the monitoring, usually there is not for the lifestyle correction part. There is not much of the monitoring, or it is so every person doing at their own pace actually. So there is not much of the studies are there. But the other 3, there is studies are there. Actually, it shows that if at all if you are taking medicine alone, or you are applying stent, or your bypass, the chance of getting a second heart attack and dying because of the second another attack, it is the same. So we should think when you are asked for a bypass or a stent, you should always think that why should I go for such things? Only the benefit it is shown that if it is a major block, 90% block, and in some patients, for temporarily there will be some relief because it is pressed and moved away. So the flow will be some little more flow will be there. That is only for the symptomatic patients. If an angina patient, it's a continuous pain. If a person who is not able to walk for a few feet, by the time the person is getting a pain in the chest or cardiac congestion, in such patients, after the applying a stent, if it is successful, can get some relief for some time. And this bypass surgery also, if it is, we are saying only one block at a point, and that after that bypassing that block, but most of the cases the further arteries also will be blocked. We don't know because from the test we don't know that only that part is blocked or the other part also is the distal part also is narrowed. So there's no test available. No one is doing a repeat angiogram after this bypass surgery or a stent also after 1 month or 2 months or 3 months. There is no such a testing is done. So we don't know anything about that. So only thing, after the surgery or after putting the stent, people will be more careful and they'll be doing some lifestyle correction. Actually, the benefit is directly coming from the lifestyle correction itself. Not much of the, when you logically think or scientifically think or from the studies, there's not of much benefit actually.
When you are just mentioning about, that repeat testing is not possible nor done normally after these procedures. So it is basically some sort of symptomatic relief and other aspects that are looked into. So how do these currently for everything diagnostic tests are there, scans are there, that is the current trend. So what is the role of these scans or tests to actually understand not only the status of the patient, but the status of the patient after an intervention, whether it be surgical or or whether it can be lifestyle?
Usually, this angiogram is the test we are doing. That is invasive actually. It has the risk also is there. It is associated with risk factor also, because there are people who the people can die on the this cath lab itself. So it's an invasive procedure. It can go wrong also, because the arteries are also blocked, and blockage is there. There will be, even in the aorta, in these patients with coronary artery disease, even the aorta, there will be atherosclerotic plaque will be there. When it is passing, that can be get injured, and there can blood clot can occur, or this fat can be dispersed and it can circulate in the blood, and on that the clot can form. So many things have happened, because it is, you're not doing in a normal blood vessel. It's not only the coronary arteries is damaged, it is the whole intravascular system is damaged, and even the aortic plaques will be there. So it can, anywhere it can get problems. That is the reason for, there are patients who are getting strokes after angioplasty and all. That is because of this, problems actually. It's a side effects actually. So whatever procedure we are doing, there will be side effects also. So after a stent, we cannot go for after 3 months, another to check the whether the stent is working. We are not usually done. I don't think any of the cardiologists are doing. But nowadays there is this trend. I am saying that if it is a difficult stenting, one stent will be put one day, and when then there was a difficulty, they'll ask for 2 weeks, or after 1 week or 1 month, repeat stenting will be. In that case, we can look, but in that case, it is very clear that the problem is not over. That is why repeat stenting is done, or repeat angiogram. It's a stent application. You had to do the angiogram also. The problem with this angiogram and this stenting is this. Patients with the coronary artery disease, or there is a block, their kidney will also be affected, and kidney the patients will be having them definitely at least cholesterol, cholesterol and this triglyceride dyslipidemia will be there, and also hypertension will be there, and most of them this diabetes also will be there. So just like the heart, this is affecting the kidney also. Their kidney function will be compromised. So when you are repeatedly applying this dye, the contrast is needed for, and the contrast injection is needed for this angiogram. So when this angiogram, contrast nephropathy can come. So it is not safe to do multiple angiograms. The same dye is needed for this CT angiogram also. So there also, if you are repeatedly doing the CT angiogram for checking whether it is working, your kidney will be affected. It's definitely, it can go wrong, because already the patient is having the kidney. Most of these patients' kidney, this GFR will be low. Usually, the doctors will not say, or reject or not do this angiogram only when the renal function is gone below 20 and all. Otherwise, generally, the cardiologist doesn't have any problem. So they will do, because usually in the modern medicine, the cardiologist will look after the heart, and the nephrologist will look after the kidney. So they, technically speaking, you can do, but the problem is your renal function will be gone down. That is the problem, and it is very difficult to live with the renal failure. So that also we should take into consideration when you are asked for an angiogram, and also the stent also.
Actually, you were mentioning about so-called risk factors when such procedures are done. We also hear that people who have otherwise lifestyle diseases which contribute to high sugar, or if their kidney has any issue, or if their liver is not fully healthy, and other factors like that. That is actually a disadvantage when planning a heart procedure. So what exactly, because most of these people will be, patients will be having these associated issues, then what should patients know?
When you are doing an intervention for the heart, either it will be this coronary artery stenting, PCI, or a bypass surgery. So both this will not cure your diabetes, hypertension, kidney disease, or any of the other disease. Only you are adding some basically after the surgery or after the stent application, you have to take more medicine. At least this blood thinners has to be more number will be there. Every patient should watch. Every patient should know you can come out of all these diseases if you are willing for the lifestyle changes. So what that is actually, it is with the evidence actually when I am giving clinically supported lifestyle correction for those who are asked for angiogram and they come for, they don't want to go for angiogram and they have already put a stent and then they are asked for a repeat stent immediately after 2 years or something like that. Or those who are asked for bypass also, I had given experience with the clinically supported lifestyle correction. And what I think that almost all these patients will be having at least three or four diseases other than that, this heart problem. Dyslipidemia, this cholesterol and triglyceride will be there, diabetes will be there, hypertension will be there, and most of them fatty liver will be there. And it depends on the age, other factors also. So all these things can be reduced, and with the very clear evidence, the diabetes medicines will be stopped, usually type 2 diabetes in the first day itself, and we can check the blood sugar at home itself, and the BP can be monitored at home, and when the BP is coming down, you can reduce one by one after another. Most of the patients will be on 3-4 medications, and the cholesterol medicine also. When the cholesterol is coming down with the lifestyle correction, you can reduce, taper off gradually. And if when any other medicines also, usually they all is actually there. These diseases are actually brothers and sisters. Actually, they will be coming together. Actually, or siblings. Actually, one is coming and then other, and we can the same way it can be reduced also if you are willing for a lifestyle correction.
With that, we come to the end of the first episode on heart disease, this 4-part episode. In the next episode, we will be looking at what are the latest treatments available for heart disease. Thank you. The informed patient is key to treatment success.